Hello everyone. Presenting a case of a 23-year-old girl with Mullerian anomaly with urogenital abnormalities of crossed fused renal ectopia of left kidney. You can see the MRI image where absent uterus you can see, and a left kidney which is fused with the right kidney on the left side, and left fossa, renal fossa was empty. On inspection we can see there is no uterus in the pelvis. Retrograde pylography was done and ureteric stenting was done to establish the location of the ureter. Along with that, ICG dye was also injected as a help during our surgery. You can appreciate how ICG is helping us in delineating the ureters on both the side, since this patient is having a cross renal ectopia of the left side where the ureter are crossing from left to right side. So this is how we are demarcating our surgical area where we need to excise the peritoneum to create a neovagina. A peritoneal lick was given to release the peritoneum from the overlying bladder, as well as lateralize the ureter so that this peritoneum can be safely used to create a neovagina. Both side ureterolysis was done to lateralize the ureter. Now the posterior dissection is carried out to dissect the rectum down so that the area between the rectum and a urogenital sinus is exposed. Now a rectal probe was inserted in the rectum and a sponge on holder was pushing the dimple into the peritoneal cavity, over which the vaginal opening was created. Now you can see the beauty of this robotic system and endosuturing with robot, how beautifully we are suturing the vagina endoscopically in cases of vaginoplasty. Routinely, such suturing is even in laparoscopy is very difficult, and this is how we have peritonized the posterior vaginal area, and the anastomosis is established between the posterior peritoneum and the posterior margin of mucosa. Anteriorly, the fold of peritoneum is pulled out and sutured externally. Now a vaginal mold is placed into the cavity through the vaginal opening, over which the neovagina is created using peritoneum and posterior rectal peritoneum all around. A bite is taken through the anterior wall of the rectum as well, and a purse string suture is placed to form the apex of this newly formed vagina. Ethibond 2-0 suture is used to do the suturing. A tubal remnant is excised and removed. Integrity and the patency of the ureter was checked and thorough wash given. Post-operatively, on day 4, the mold was removed. You can appreciate how big the vagina and the margins are looking. And on day 10, you can appreciate how easily a soft mold is going in the vagina. Thank you so much.